to Thursday Thought Leaders with Harbinder Narula on BW Healthcare World. My guest today is Tanaz Buhariwalla, who's the director of IDA Ireland in India. She brings over 3 decades of international trade expertise, and of which 1 decade has been with IDA Ireland, and where she aids Indian companies in expanding to Europe. Her strategic counsel benefits MNCs to SMEs. So it's a wide variety. But what she strongly believes in and advocates actively is the concept of diversity and inclusion in whatever she does. And Tanaz has become a voice in organizational well-being. So welcome, Tanaz, to BW Healthcare World. It's such a pleasure to have you with us. Tanaz,
Thank you, Harbinder.
Yeah. So Tanaz, you are representing IDA Ireland. So it's all about trying to find, kind of collaborative opportunities between the two countries of how it can be mutually beneficial. Now, how is Ireland positioning itself to become world's leading employer of medtech professionals? Because until now, until I met you, I did not know that Ireland was focusing on this.
Right. So thank you very much for today, Harbinder. It's great chatting with you. And, Ireland has long been one of the epicenters of the medtech world. Okay. Not only has Ireland been chosen as a base for a number of foreign-owned companies. So that's what I do. I work with ID Ireland, which is the Irish government's FDI agency. So I help, in our case, Indian companies set up in Ireland. So not only has a number of foreign-owned companies chosen Ireland, medtech companies chosen Ireland to base themselves there, but we also have a very large base of local Irish companies. Now they're all there because there is just excellent talent available. The government is supportive, and then there is this whole reputation that Ireland has across life sciences and medtech for let's say timely research and development, and everything is having a global impact. So when I say that, companies in Ireland really manufacture for the world. So while we have the global top 14 of the 15 medtech companies, it is one of the top 5 global medtech hubs, and it is also the second largest exporter of medtech products in Europe. So over 13 billion euros of goods are exported, medical devices are exported to over 100 countries from Ireland. Now, this success is largely because of the track record, but more importantly, the talent it has. Now, this talent comes from across the world. So while there are a lot of course, local Irish people working, Ireland is part of the EU. So you have people from across the EU coming in. But equally, Ireland has a very large bouquet of work permits. So you have people from across all countries coming in to work in Ireland. And these are forward-thinking, trained, skilled people with a lot of experience behind them. So this helps basically the entire ecosystem in Ireland to grow, to continue to grow. Also, the government invests in a lot of centers of excellence. So there's a lot of medtech hubs in Ireland as well.
Now, Tanaz, how is Ireland contributing to the enhancement of digital healthcare globally? You said it is becoming a hub for medical technology. And also, what are some of the significant medical technologies and advancements currently being developed or utilized in Ireland?
Sure, Harbinder. So now this is a lot of the technologies that are being developed in Ireland are, like I had said earlier, by the large medtech companies. But there's also been notable developments, advancements which have been made by local Irish companies. Now, some of them would be in, I'll give an example of this in the bio-innovation space. There is a local company that is, it's a startup. It manufactures prosthetic surgical replacement basically for the thumb base joint. Now, this is generally affected in arthritis. So there is one that does that. There's a very beautiful company that's working on regrowing bladder cells for that were removed due to cancer. Another company basically helps. It's a virtual ward. That's what it does. It uses technology to create virtual wards, and this allows for patients to monitor their own health remotely. Therefore, it frees up resources at hospitals, and it helps during emergencies. And now we all know wearable technologies. This is hugely beneficial in the world of medicine. There continues to be development in wearable technology. Even in India, there are some really good companies. And so there is this one company in Ireland that's using wearable technology to explore the use of wound management or wound care. So basically, the device can monitor the wounds and track how it is healing. And it continues to provide the real-time data to healthcare providers. Therefore, this assists the healthcare providers. There's another one, and I kind of like it personally. It's a wearable device that assists people with speech difficulties. It's a telehealth model, and it connects speech, language, and occupational therapists with families who need them. Basically, this is cutting access of support, these kind of support for families from years to literally hours. So I think that's a beautiful company, where it helps people, and it largely the beneficiaries would be smaller children, kids. There's technologies for cancer diagnosis, cancer treatment. There's innovations in telemedicine, appointment scheduling. Now those we see in India as well. So a lot happening, Harbinder. And these that I've mentioned are really local companies, not the global companies. The global companies continue to invest and research in all kinds of R&D for their own products.
Got it. And Tanaz, India also has their own set of very, very smart engineers, and we've proven that to the world. We've had the best doctors, we've also had the best engineers. Now, what strategies have you found most effective in helping Indian companies establish and grow their presence in the Ireland medtech sector? And maybe you can share some examples of how an Indian company has benefited by being present in Ireland.
Sure, Harbinder. So my role, as you know, is to help Indian companies in their internationalization plans. So the first factor to bear in mind is that the companies we work with are those that are going to expand overseas, and they are expanding because either they have a ready market, or they're looking to explore new markets, or B, basically a lot of them are there to manage their supply chain security, basically. And that's the need of the hour. We see that with pharma companies as well. Now, how I engage is, how we work is I engage with the companies to understand their expansion plans. Then I explore with them whether Ireland is a solution in their expansion plans. Now, towards that, to understanding is Ireland a solution, I first understand what is it that they wish to do overseas. Is it something they need to do in the Western world, or is it for the Far East or developing countries? Now, once we work through all of that, I work with, and for those that are for the Western world, I work with them to give them information on what they can do in Ireland, how Ireland will be a good fit. We also give comparative information on other locations, and a lot of this information is from independent sources, right? Now, next step with my colleagues in Ireland, we help the Indian companies meet the ecosystem. So the Indian company representatives that travel to Ireland, we help them to meet the regulators, the ecosystem, service providers, regulators, other companies. Now, these companies could be potential partners, could be suppliers, could be clients even. And then we help them find the right location in Ireland. So they're part of an ecosystem that kind of helps them. If they need to meet with local authorities or a research institute, industry association, anything, we help them. And we also give them information on costs, on the local laws, anything else that is relevant. So basically what we're doing now, Harbinder, is we are arming the company with all the information they will need to make a business decision of locating in Ireland, or using this information to see where else they can locate. Now, once they make the decision, we help them to settle in Ireland. Now, for qualifying companies, there are financial grants as well. And once a company is set up, we continue to stay in touch with the company. We ensure that they get along fine. We step in when there is any relevant help or information required. So you see, I can say we work as consultants, advisors, or trusted partners. Because we're government, we do not charge for anything we do. And therefore, the benefit for us is the continued success of the company setting up in Ireland.
So, Tanaz,
You would also ask about, sorry.
Yeah, please go ahead.
You'd also ask Harbinder about some case studies. Now, I'm sorry, I can't share the names right away. I'll need to check with the companies prior to doing that. But what I can share is we have an implantable lens company. These are all from India, I'm sharing. An implantable lens company in Ireland. Now, they have been there since 2014. This company, it continues to grow in terms of its operations, as well as the market it services from Ireland. Their markets extend all the way from EU to Latin America to the Middle East. We also have a stent manufacturing company from India, and they are supplying their products across the EU. And in fact, pre-COVID, the company was always also involved with one of the medtech centers of excellence in Ireland. It's called Kuram, and this was a global project to conduct clinical trials for their new generation stents. Besides this, we have a IVD company. We also have a project at the moment underway where the Indian company has finalized Ireland, and now they're waiting on machinery before they begin operations. One of our existing clients, one of the companies that's already in Ireland, is looking at an expansion project in another part of Ireland. And then there are two other greenfield projects that I'm talking to with companies. So we have a healthy pipeline. The companies see the benefit, those that are already there, and the others have basically heard about the success of their peers, and therefore all these conversations that are very promising.
Tanaz, I can understand Indian companies benefiting, by going to Ireland to get access to the global market from there. But how does India add value in positioning of Ireland within the EU?
So I'd say two of the companies that we have in Ireland currently, these are Indian companies. One is the largest in Asia in its own field. So there is that whole value the company is bringing into Ireland. The company into Ireland and the EU, because it's supplying to all across the EU. The companies also, there's a lot of, they tend to take their local staff, some of their local staff from India in their companies in India into Ireland. There is all the addition of the, from a diversity point of view, there is a richness, different richness that goes into the marketplace. And therefore, then it kind of adds to the whole base in Ireland, where the government is all supportive for multicultural people coming in with certain skill sets that basically enhance the whole knowledge economy that the government is looking to build. It is already there. There's loads of American companies in Ireland, American people working in Ireland. But now we're looking at, the Irish government's looking at the Asian markets. And, India is quite high up there in terms of the numbers of people from India going to Ireland to work, the number of companies from India that are setting up in Ireland. And therefore, it's all just adding that richness, that value, which diversity can only bring.
And Tanaz, you were talking about the talent pool, the labor pool that you are, as a country, Ireland has to offer to these companies that are going and establishing a base there. What about the cost of this talent? I mean, we as a country like India is known for low cost talent. So how does this work out for Indian companies when they go and establish themselves in Ireland?
So an extremely valid point, Harbinder. It is more expensive to do business in Ireland. So you are part of a Western European jurisdiction. It definitely is expensive. These companies are manufacturing in Ireland. They're selling in Ireland at the same time. Sorry, not just Ireland. They're selling in the global market at the same time. Most of this global market for them is the Western world. So obviously, if their cost of manufacturing is higher, their cost of talent is higher, so is the cost of the product that they are selling. And also being part of the EU, being part of Ireland, Ireland is part of the EU, they get the CE accreditation. Now, whether we like it or not, it may be a perception, but the fact is a CE accredited product will definitely demand more value or more costs, will give you a more better price point than a product sold from India. And I can tell you with conviction, I have seen the plant, one plant of this Indian company in India, absolutely identical process, machinery, everything in Ireland. It's just largely the labor cost, the land cost, the utility cost, which differs. But if this company has about ballpoint 8% higher costs than India, they're charging a 12% markup on the cost of the Indian product that is being manufactured in Ireland. So you see, there is a benefit in any case. So yes, it is higher cost to manufacture in Ireland, to do business in Ireland, but then so are the benefits you get as a, once you sell your product or services.
And are you just looking at taking Indian companies who want to establish a base there in Ireland, or are you also looking at taking Indian professionals who would want to move to Ireland to work with various, to work in the medtech sector?
No, so the organization I represent, which is IDA Ireland, it's quite clear we help companies set up in Ireland. There are a number of, so there is a requirement for medtech talent. Now, I was reading a report, I'll just quickly aside, I was reading a report which said that in the next decade, 133,000 skilled workers will be required in the economy. Of these, 90,000 are going to be medtech skilled workers. So that's a lot of workers. And given the density of the cluster we have in Ireland, medtech cluster, we definitely have the need for more talent. So it is up to personnel to approach these companies direct or via a recruitment firm. And there are quite a few recruitment firms, Irish recruitment firms, that operate out of India, and a number of Indian people that do travel, not necessarily with an Indian company, that do travel to work in Ireland. The highest number of work visas issued by the Irish government in the last 5 to 6 years are to Indian nationals. And these could be across the world. So Indian nationals from the US as well, but that's the number we're talking about.
And Tanaz, I know that you're a big believer of diversity and inclusion. Now, how does promoting diversity and inclusion within organizations in the medtech sector contribute to innovation and business success? And also, you might want to share some initiatives that you have taken to support diversity and inclusion. I mean, you're being a champion of DNI yourself. What is it that you're doing within your organization to promote this?
Sure. So there is broad agreement on the beneficial impact of diversity in management and leadership roles. Now, this is long established, okay? But we have to appreciate that much of the innovation or the innovative capacity of an organization actually is realized at a unit level in working teams. So there's a lot of research being done at the moment, and the recent research points to the fact that cultural diversity has an especially significant impact on innovation in any team performance. Now, I'll give you quickly some points why. When a diverse team comes together, basically it's bringing individuals of different backgrounds together, different experiences, different perspectives. Now, this is the diversity which fosters creativity. Basically, it encourages, let's say, innovative thinking, right? When people of different walks of life collaborate, they are approaching their problems from unique angles because they have unique life experiences. And this leads to novel solutions and breakthroughs. It's also just known that, in an inclusive environment, employees feel comfortable to share. It could be ideas, it could be perspectives. And this is what leads to disruptive innovations. The employees land up feeling valued, they're respected, so they tend to feel motivated and give more. There's many things like, a diverse team. If I bring it more to medtech, a diverse team is also better equipped to understand the needs of a broader range of patients or customers, right? The patient population itself is so diverse. So then you have to cater to various backgrounds. It could be socio-economic backgrounds as well. There's cultural context, there's gender to consider. So all these things, is where innovation is fostered. And basically what I'm saying is, I've committed a lot of my time on the EDI agenda, right? Promoting and delivering EDI. I'm doing this since 2017 with IDA. We started off with DNI, which is diversity and inclusion. But over the journey, we also realized equity is extremely important. Equality, equity, where everyone is equal regardless of their background, etc. So I look at it more from a holistic EDI perspective now. And there is just no doubt that creating a work environment or a culture where every individual feels safe, has a sense of belonging, feels empowered, only then can they achieve their full potential. And this is what leads to high performing teams for an organization. So it's a wholesome environment, and regardless of the sector or even the size of an organization, every company, every employer should strive to offer a work environment which is equal, inclusive. You can bring in diversity. It only enhances the quality of the work that that is being done in your organization. Now, to what have IDA done? Whole host of initiatives, Harbinder, loads of things. But to remember, it was a planned program. It doesn't just happen. You need buy-in from the highest level down to the lowest. The communication is extremely key. Now, in IDA, we started with a committee. In 2017, like I said, my CEO approached 4 of us to say, would we be part of this founding committee? At the time, we looked at it so simplistically. We said we will look at gender, we would look at sexual orientation, and we look at multicultural diversity, because IDA is a global organization. We have loads of Irish people, but equally people from other nationalities like I am. So we were looking at all of this, and we began by looking at what is external best practice. And then we also undertook an extensive exercise to see what is the reality on the ground in the organization itself. What do people think? What do people have to say? So, we did all of this. Today, I'm proud to say that as an organization, we have a number of nationalities working in Ireland, in the Irish office as well. There's a great balance of genders across all the levels. It's represented across all age groups even. So we can say that IDA is truly inclusive. How did we do this? Training courses. First was just information gathering. Then came all training courses, various training courses, webinars, in-person events, courses like unconscious bias. Though I consider myself very inclusive, broad-minded, everything, these kind of trainings even threw up certain things that made me reflect. So I can imagine people with their own, now this, I'll just send an aside. I feel people from India, we're just exposed to such a diverse culture, people we come across, in our regular walks of life, across all socio-economic background as well. I think I've just learned that, Indians tend to be a lot more inclusive. There is a whole other conversation on another part, but largely, and that some things that seem very basic to us, it isn't really basic when you talk to people who come from more closed countries or exposures, let's say exposures. So we did all of these webinars, basically knowledge sharing webinars and events and training courses. Like we even did sessions on India, doing business in India, doing business in Japan, doing business in anywhere else, so much difference. So everything we could think of, some fun, some quiz and all kinds. And today we don't have these simplistic verticals. It's multicultural, it's socioeconomic, gender and sexual orientation, it's ability, it's your background, it's stage of life even. So much more. So like I said, it's all about sharing the knowledge and all of that. The key was buying from senior management, then percolating it down to every level. This was treated like a business vertical. We had to prepare a strategy, approach our board. We had certain deliverables. We were allocated budgets, and then we were measured. Today, IDA is accredited, gold accredited by the Center of Diversity, the Irish Center for Diversity. We got the bronze. We failed the silver the first time, and our first attempt, we learned lessons, and we've got the silver. Now we are gold accredited. So it's a journey, and a journey one has to be very committed on as an organization.
And Tanaz, why is there a specific focus on medtech? I'm sure Ireland is looking at Indian companies beyond healthcare. But what is the specific focus on medtech? What do you think is, Ireland's role evolving in terms of global health, using getting companies from India to Ireland? And also, what are the opportunities of collaboration? I mean, it's not necessarily that the company has to go and establish, but what are the opportunities of collaborating between Indian companies and the Irish-based, Ireland-based companies in the same domain?
Oh, absolutely, Harbinder. So I'm just looking at one part of the government, one department that helps Indian companies in Ireland. There's also another department that helps Irish companies come to India, do business in India. So we have, that's called Enterprise Ireland, and they have a team as well. Now, like I said, while we have a host of foreign-owned companies in Ireland, we have Irish companies, a rich base of Irish companies, and a number of them are operating in India. Enterprise Ireland continues to work with them to see what more can they do in India beyond just, partnering with a company to sell into India, or, we're looking at today research. All of this sits under the ambassador as well, the Irish ambassador. So his view is a little more holistic. He's looking at where can we form partnerships. Now, these partnerships could be with research institutes, with various companies. We engage closely with Invest India as well. So it's a big program across many levels. And I can tell you that I have facilitated one of India's top 6 pharma company that is looking to diversify into the medtech space as well. I have taken 2 senior members into Ireland. We've moved around meeting a host of Irish companies that this Indian company can bring to bring to India, manufacture on their behalf for the Southeast Asian markets. So there is a lot that is going on along with just what I have mentioned.
And Tanaz, what trends do you see in medtech industry, particularly in Ireland, over the next 5 or 10 years? And how is IDA preparing to meet these trends and continue supporting the medtech innovation and employment in Ireland?
So Ireland, the way it works in Ireland is very collaborative. The Irish government is invested in a number of research institutes or centers of excellence. And these are based within universities. And these universities are largely around where a cluster, anywhere a medtech cluster is developed. Today, it's not just restricted to medtech. There's also pharma, and it's all at the crossroads of pharma and engineering as well. So the government, Irish government, has formed groups where industry and academia, cutting across pharma, medtech, ICT, and engineering, sit and discuss on not so much blue sky problems or blue sky research, but more shorter term, what industry really needs. There's a lot of discussion on all of that. And then that leads to what is the talent requirement of the industry? And therefore, how can academia then step in to churn out the next round of talent? So all this is being done on the one hand, and we all know that, post-COVID, there's been a lot of focus on remote healthcare delivery models, for example, telemedicine, virtual consultations, or remote monitoring. Therefore, the cloud data management becomes important. IT becomes, of course, extremely important. There is the whole use of artificial intelligence today, basically capturing the data, then data interoperability across various platforms. And then there's also cybersecurity to look at. All these are focal points. And I think there is no simplistic answer. It's like, artificial intelligence, but cutting across so many domains, from scans and diagnostic equipment to risk predicting. That's very big. Early disease prognosis or diagnosis, surgical robotics, which requires, precision, all of this. So it's the same globally. There's a lot of focus in Ireland on these areas, largely, not only, but largely. And I think if there's any Indian group, company that works, and IDA has approached a number of smaller Indian firms with like startups with really innovative products, and some of them are just beautiful that, in India, we've reached out to them to see would they benefit from being part of the group that is discussing. We're not asking them to relocate. They're also small, so there's cost constraints. But if they could be part of the group, project group, there could be some funding available to them from like a global fund available. So we're doing a lot, but it's just such a vast landscape that, it's not easy.
I can completely understand, Tanaz. But I think it's a beautiful collaborative opportunity for two countries to work with each other and create a platform where each country and its people and its companies can benefit from the strengths of each country. I see the advantage of getting access to the global market through Ireland, the use of access of the medtech talent that is available in Ireland. And more than that, the specific benefits or the advantages or the strengths that Ireland has already built around the security, both in terms of supply chain security and in terms of cyber security that you shared with us. So I think it's a beautiful platform. It's great to see the work that IDEA is doing and what you are doing specifically with your belief in the diversity and inclusion, and how you are actually working on it within IDEA to set an example. So that's a very beautiful thing. Tanaz, thank you so much for speaking to us today.
Thank you. A pleasure, Harbinder. Good luck.